My name is Lee Sharp, Director of Mental Health at K2 Associates. I would like to explore with you why workplace mental health matters and how your organisation can begin its own journey to support your people thriving at work. Earlier this year, AXA published its 2022 study of mind and health and well-being. The study offers valuable insights for UK companies. More people are now aware of and are comfortable to self-report about their mind health, with 49% in the UK feeling that they're better able to acknowledge when they may need support. The UK currently has the highest prevalence of mental health conditions in Europe, but only 4 in 10 employees in the UK say they feel that their company provides good support regarding their mental health. Yet, if UK employees are offered such support by their employers, they are twice as likely to flourish. Therefore, UK employers have both an opportunity and a challenge. The challenge? A clear need and a gap in better supporting mental health at work. The opportunity? An increased openness and receptiveness to discuss mental health across its people. But how do we go about addressing this challenge and opportunity? Clearly, people want to be better at managing their own mental health, as 84% of people have a strong desire to be good at doing so. That said, 1 in 3 people admitted to finding the entire mental health and well-being area confusing. When asked, people said they wanted general advice and someone to talk to, as well as advice on methods to improve mental health. A mental health culture spreads in an environment where all staff at every level feel comfortable talking about well-being at work. It cannot be overstated just how powerful it is to have an executive or line manager opening up about their own mental health challenges. This act alone gives other workers, especially more junior staff, license to do the same. So somewhere in the gap between employers' wants and their reality, things are going awry. Among survey takers, 9 in 10, or 89% to be precise, said a work-life balance was key, yet only 2/3 of people claimed they were happy with theirs. More troubling is the finding that 1 in 3 of all respondents believe leadership stands in the way of delivering a mental health and well-being culture at work. Likewise, though, 60% of employees said they felt responsible for supporting workmates with their mental health, with just 54% of them feeling confident about doing so. Knowledge is empowerment. Helping staff to nurture and protect their mental health is as much about the organisation as it is the individual. Just learning about mental health is proven to improve your well-being, and research has showed the importance of mental health training, with 87% feeling it was a key for managers, employers, and employees alike. By boosting everybody's mental health and well-being understanding, you also equip staff at every level, whatever the skills they need, to support their colleagues' mental health as well as their own. What's more, you plant the seedlings for a better, joined-up culture, one where outdated stigma is swapped for reliable insight, where no one is afraid to be candid about their well-being experiences, and psychological safety is no longer an abstract fantasy but a firm-wide reality. To make this reality, organisations need to consider introducing and implementing a mental health and well-being strategy, policy, and guidance document. So, what are the key themes for a mental health strategy? Traditionally, workplaces have taken a reactive approach to mental health, offering support to an employee once mental health symptoms have started to impact their day-to-day functioning, and results generally in recovery taking much longer, impacting productivity for the individual and the organisation. There is of course room for this support and reactive approach when it's needed. However, a proactive approach to prevention of poor mental health where possible is more desirable. The WHO, the World Health Organization, just released their mental health at work policy brief, setting out 4 key messages. 1. Prevent work-related mental health conditions through psychosocial risk management, which includes using organizational interventions to reshape working conditions, cultures, and relationships. Number 2, protect and promote mental health at work, especially through training interventions that improve mental health literacy, strengthen skills to recognise and act on mental health conditions at work, and empower workers to seek support. 3. Support workers with mental health conditions to participate fully and equitably in work through reasonable accommodations, return to work programs, and supported employment initiatives. And 4. Create an enabling environment with cross-cutting actions to improve mental health at work through leadership, investment, rights, integration, participation, evidence, and compliance.